This is Martina Gomez of ADU News Update. A disease called coronavirus is still on rise based on increasing rates of active cases and affected millions of people. Everyone has their opinions or even violent reactions with what is happening across the globe. Our fellow citizens suffer from social problems while in home quarantine. Today, students from Adamson University will take over via live stream for a campaign for social transformation entitled Pagbangon ng Bayan sa Diwa ni Hesus at Gabay ni Enteng. Their particular issue focuses on health and wellness that highlights the poor public healthcare.
A pleasant morning to everyone. I am Norah Almeda, a BS Psychology major from Adamson University Psychology Department. I'm here together with Ms. Batac to clarify what our social transformation campaign is all about and why the poor public healthcare system here in the Philippines is a relevant issue today. The unfortunate reality for us Filipino families experience equity and access to critical health services. Philippine public healthcare overlooks specific restrictions. In spite of having universal healthcare, our country is still on a competitive survival when it comes to unequal access to medical care. Open healthcare within the Philippines has standards that urban centers have greater access to healthcare service due to the fact that they have complete equipment. In contrast to that, rural areas have insufficient healthcare owing to a lack of budget. Public healthcare strives to treat the enormous Filipino patients who solely rely on public Medicare, from the current Filipino doctors and nurses who have been migrating to Western countries. As for the resolution, inadequate staff in some hospitals amidst the pandemic in our present day, and most patients could encounter delays in treatment. Why is this issue urgent and how is it related to this pandemic? This issue should not be set aside, especially now that we are in a global pandemic and our country has one of the highest cases of coronavirus. The healthcare system in our country needs attention and more medical resources should be given. Our healthcare workers are in need of our help to lessen the number of cases.
Hi everyone, I'm Mhekyle Batac, BS Psychology major from Adamson University Psychology Department. Referring to what Ms. Almeda had stated, as representative for our social transformation campaign, we aim to widen your knowledge about poor public healthcare system, particularly here in the Philippines, as we expound the cause and effect for this social issue. Number one cause is only 30% health professionals employed by the government address the health needs of the majority. Number two, healthcare in the Philippines suffers from a shortage of human medical resources, especially doctors. Number three, social injustice is one of the factors why we have a poor public healthcare system. So number one effect is healthcare in the Philippines suffers because the remaining 70% of medical health professional workers work in more expensive and privately run sectors. Number two, due to lack of human medical resources such as doctors and nurses, the system runs slower and less efficiently. Number three, social injustice creates a condition to oppose and influence the individuals and communities which result to human violation. It declines the equality of having their basic needs met.
For our last agenda, the proposed solutions to be sustained are associated with the seventh dimension of wellness.
Yes, that's right. Our campaign about health and wellness would not be complete without the current social problems regarding poor public healthcare, especially for the youth society.
Celebrating Ramadan during COVID-19 pandemic, spiritual wellness, mental health wellness amidst COVID-19 pandemic, emotional wellness, community pantry movement of Filipinos, physical wellness, prioritization for medical workers to be vaccinated, occupational wellness.
Filipinos honor medical workers on Araw ng Kagitingan for social wellness. Support and empower environmental-friendly practices for environmental wellness. Be knowledgeable enough to your rights for intellectual wellness.
Thank you for joining us, representatives of Adamson University, Ms. Batac and Ms. Almeda. Again, this is Martina Gomez of ADU News Update. Ang pagbangon ng bayan sa Diwa ni Hesus at Gabay ni Enteng on health and wellness.
And we are the second year BS Psychology students of Adamson University.
Make sure to spread awareness, help everyone because everyone matters.